What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. I live next to a bike path, and every time I leave my neighborhood, I will often see people running or riding their bike. And I'm a people watcher by nature. I enjoy watching how people move, and it provides a lot of information to me as a sports medicine physician. So it's just something I just constantly do. And one observation I have is that, oftentimes I see the same person running at the same time. Since I leave for work the same time, they tend to probably run the same time. So I see the same folks running, and it's pretty common for me to see someone running, and then eventually I will see a knee brace. And in this particular case, it's a counterforce or patellar brace. So something that you see for like a runner's knee. And I see them running and running and running with a knee brace on the right side. And then all of a sudden I see it on the left side. And eventually that person I don't see as much anymore, or I see them less frequently. And that's a pretty common occurrence, when I see people move. So I thought that I would do a talk on what is a counterforce brace and what is it actually supposed to do. So the counterforce brace is pretty common for runner's knee or tennis elbow or golfer's elbow. And this is not like a neoprene sleeve that envelops the entire joint. It's usually a strap of sorts that's placed along the elbow or along the knee, just over where the tendon is. And it's very effective. And essentially, the idea behind the bracing is muscle tendon unit. It usually goes from muscle, tendon, and then there's actually bone. The tendon attaches to the bone. Anytime there is a transition of tissue, meaning muscle to tendon, tendon to bone, all three of those structures receive the same amount of force. Now, the issue is that tendons are not as resilient compared to muscle and bone. So it's inherently a weak point. So when people develop pain related to the tendon, they will often put the brace directly over the tendon. And what that does is that it does two things. Number one is that it moves the tension point. So as opposed to the tendon, where the tendon and the bone attach, it's actually where the bone is and then where the brace ends. So it almost widens the footprint, and it also moves it a little bit further down or more distally. So that can be very, very effective in terms of knee pain and elbow pain. The main purpose of the brace is to help distribute force. But what it does not do is address these other factors. Number one is the volume. So typically, when I mean volume, it's usually repetition. So when people have pain problems, they usually end up slowing down. And the brace takes care of the pain. And so people usually go back to the same volume that they were doing. And even though you change the footprint, you make it larger, the tension still goes through all of those structures. And tendons do not heal very well. And so they take much, much longer compared to bones and muscles to actually recover and then also regenerate. So most people put on the brace so that they can keep up their level of activity, but they don't ever, I shouldn't say they don't ever. People typically will not slow down. This leads into the second thing that braces don't help with, recovery. It's kind of along the same lines. Recovery cannot be sped up. I mean, there's definitely factors that can slow things down, but even in the regenerative treatment model, like stem cell, PRP, things like that, you're not speeding up the process. You're actually just triggering the process to happen at the rate that it was going to anyways. So while your muscles get the benefit of the exercise and the brace allows you to continue to exercise, the tendons do not recover at that same rate that the muscles do. Muscles can hypertrophy, they can tear, they can recover much, much faster. But all the brace is really doing is just allowing you to work more, but do less recovery. And this is a big problem. It's very unusual for me to see someone use a brace and then slow things down to work on their overall recovery. And that's where, the runner example I see pretty common. Someone runs without a brace, then there's a first brace, and then there's a second brace. And then eventually I stop seeing them run as much. And so if I had to guess, that's probably around the time they start, trying to take anti-inflammatories or they're having to see somebody about it. Now, the last thing I'll mention is about movement. Bracing does not really change movement. The mechanics of landing and the mechanics of gripping and mechanics of throwing are not addressed by the brace. And there's a very, very strong correlation on poor mechanics in the development of tendon and joint problems. So again, this is where braces do not change anything. The volume and the mechanics has to be very, very intentional. And while pain slows us down and we like to be physically active and exercise, if we don't work on these other factors, the braces will help you only so much. Now, I'm not anti-brace. I've heard a lot of people say, well, braces are bad for you anyways because they you become too reliant on them. You start to atrophy, and I just don't really buy that. At the end of the day, if the braces do allow you to be more active, that's great. But if the braces allowed you the opportunity to recover, to learn different movement patterns, to learn how your body responds to exercise with time, I would love that. But it's not really, humans are human. That's not really where our focus is at. It's usually on, let's get this exercise in, and so I can move on with my day. Learning rehab is boring. That's just the way that it is. And I understand that. And it's just kind of the way that it's always been. But it's also why sometimes I'll see these fancy braces come onto the market. And I just know that while they might help, the problem is still there. They only help with the force part of things. They don't change the volume. They don't change the recovery. They don't change the mechanics. And until we start doing that, pain is always going to be there. Tendinopathy and bursitis is always going to be there. But I'll leave you with this one last thought. If you're using a brace, I think it's a good idea to define what it is actually doing for you or what is the goal of the brace. If it helps you with pain, if it helps you with stability, that's perfect. However, I think you should also ask yourself, what is the brace not doing for you? Or what is it allowing you the opportunity to work on? I think if you approach your injury, your rehab, or your general movement in that fashion, and the brace allows you to work on other things, I think that's the best way to use a brace. Thanks again, everybody. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.